So adverse drug reaction. Adverse event information for Luvox was collected from adult patients diagnosed with major depressive disorder or obsessive-compulsive disorder and treated with Luvox in controlled trials. Adverse events leading to discontinuation of treatment. Of the 1,087 patients with MDD or OCD that were treated with Luvox in controlled clinical trials, 22% discontinued due to adverse events. Adverse reactions that led to discontinuation in at least 2% of Luvox-treated patients in these trials were nausea, 9%, insomnia, 4%, somnolence, 4%, headache, 3%, and asthenia, vomiting, nervousness, agitation, and dizziness, 2% each. Adverse events with an incidence of greater or equal to 5% reported in double-blind, placebo-controlled trials in depression and in obsessive-compulsive disorder are presented in the following table. Okay, so we'll just go through it for the depression side of things. So it has 2 columns for depression, 2 columns for OCD, and we'll just rhyme off some of them here. So somnolence, 26%, agitation, 16%, insomnia seems to have happened 14% of the time, dizziness, 15%, tremor, 11%, and as I'm going through these, you can compare these numbers to the numbers of that of placebo. So if there's a big difference, then more likely to have that side effect. Depression, 4%, same as placebo. Nervousness, 2%, same as placebo. Anxiety is same as placebo as well. Nausea, 37%. Dry mouth, 26%. Constipation, 18%. Anorexia, 15%. Diarrhea, 6%, but it's the same as placebo. And upset stomach, 3%. 22% experienced a headache, 6% pain, 5% asthenia or abnormal weakness, and abdominal pain was the same as placebo. Sweating increase was actually more with placebo. And 1% for abnormal ejaculation. Adverse reactions following discontinuation of treatment. There have been reports of adverse reactions upon the discontinuation of Luvox, particularly when abrupt, including but not limited to the following. So dizziness, abnormal dreams, sensory disturbances, sleep disturbances, agitation, irritability, anxiety, fatigue, confusion, emotional instability, headache, tremor, nausea, vomiting, diarrhea, sweating, palpitations, or other which may have clinical significance. Isolated cases of withdrawal symptoms in the newborn child have been described after the use of Luvox as well at the end of pregnancy. And they talk about less common side effects, which we won't go over. Talk about metabolism, which I don't think is too important to go over fully here. I will read the overview. So metabolism of fluvoxamine. So fluvoxamine is mainly metabolized by CYP2D6. CYP2D6 is responsible for the metabolism of substrates such as tricyclic antidepressants, phenothiazines. In vitro data suggests that fluvoxamine is a relatively weak inhibitor of CYP2D6, and hence the potential of interactions with compounds metabolized by this isoenzyme is low.